Good afternoon, everyone. Thank you for being here. I appreciate that. Appreciate everybody who is tuning in to get our daily update. I am very happy that I have a couple special guests with me today. I have Dr. Robert Corona, CEO of Upstate New York, or Upstate University Hospital in Upstate New York, and Nancy Page, our Chief Nursing Officer of Upstate University Hospital. Dr. Corona has been a tremendous partner. Upstate has been a tremendous partner, and they are helping us with our other hospitals be on the front line of this, but they have a very special announcement they would like to make today. So at this time, Dr. Corona, the mic is yours, and I'll adjust it for you. Please don't touch it, Dr. Corona. There you go.
Thank you, County Executive. Thanks for having us here. I'm happy to announce today that the CEO of Stony Brook Hospital downstate made a call out for help. They need staff badly, and so the call out went to our nursing staff, and we have a large contingency of nurses that are going to be heading downstate to help out with the Stony Brook initiative. They are getting overwhelmed right now with COVID positive patients, and they're building a 1,000 bed hospital on their football field, and our nursing staff is going to go down there and support them. So I'm very, very happy about that, and I'm glad to make that announcement today. So thank you. I'm going to introduce Nancy Page, our Chief Nursing Officer, to give you more details. Thanks.
Thank you, Bob. We have 22 of our PEP represented RNs who will be leaving Upstate University Hospital tomorrow to head down to Long Island. There are fellow RNs from across our region who are also answering New York City and Long Island's call. The passion for our patients and the passions for nursing's profession is really the selfless driver of these incredible staff. Upstate nurses come from across our emergency departments, from all of our intensive care units, and we certainly wish them safe travels and personal safety in their mission, and certainly hope that this gives Stony Brook University Hospital the support that they critically need at this time. Thank you.
Thank you, Nancy, and to your team. We're very proud of all of our nurses that are taking this endeavor. We're very proud of all of our nurses and healthcare workers here. We've talked a lot about, there's been a lot about, we're one state, what can we do to help? Upstate and Stony Brook have a proud history of helping each other. And certainly Long Island, when you look at what is happening in New York State, Long Island is really in a point of crisis right now. I know the Suffolk County Executive, Steve Ballone, will be very happy to see some of our nurses coming down to see them. So I want to thank Upstate for everything they do here for Onondaga County and all of Central New York and Northern New York, but also for this, this is big, sending down some of our people that we can spare to help our fellow New Yorkers down in Long Island. So saying that, let's get into some data. 422 cases, up from 397 yesterday, 25 new cases since yesterday. We have 41 individuals in the hospital. That's representing 15% of our active cases. This is up from up 3 patients from yesterday. 22 individuals out of our 41 are in critical condition, representing 5% of our active cases. When you're in critical condition, you're in the ICU, you're in a fight, many times you need help breathing. We don't want to be in this position. These people are in our thoughts and prayers at this time. We have some data here about our 41 hospitalized. As we get more and more data, we can get caught up, we share it with you. Out of the 41 individuals, 22 of them are Caucasian, 11 are African American, 4 are of a different race, and 4 are unknown at this time in our data collection. All of those who have passed away of COVID-19 in our county have been Caucasian. A reminder about the hospitals and our daily reporting, we just kind of alluded to it, but we don't just, the numbers I'm giving you are for Onondaga County specifically, except I'll give you a total for the region in a minute for cases, but our hospitals experience overflow from other counties as well. And so they have individuals who live in our surrounding counties that utilize their doctors and their affiliates on a daily basis. And so, of course, if your doctor's affiliated with St. Joe's or Crouse or Upstate, you're going to go to one of those hospitals. So we've talked about Central New York really, in Onondaga County, really being the ground zero for a medical response for our healthcare system in Central New York and Northern New York, and this is why. So from serving people from the Canadian border to the Pennsylvania border in the southern tier, whether it's been testing for COVID-19 or certainly our patients. Right now, if you look at the counties that we've been serving traditionally in Central and Northern New York, there's almost 1,200 positive COVID-19 cases. So this is impacting us. We're not as populated as Long Island is, or Westchester, or New York City, but certainly when you put things into percentages related to populations, we have challenges. This virus is here, and we need to take the proper steps to starve the virus. Today, there are 141 people who have recovered and are released from mandatory isolation. So that puts our active case total at 275. That's up 3 from yesterday. So we had a good day in the last 24 hours with recoveries in Onondaga County. We had 22 recoveries. The challenge is we had 25 positive cases. We need to invert those numbers, and we'll be talking about that as we always do. 45 individuals out of our positive caseload of 422 are contacts. We know that when you have 10 individuals who have COVID-19, at least one out of those 10 positive cases, someone in their family, in their household is going to get it. That's what those contacts represent. Those are household contacts. That's why sometimes you'll see our frustration when we give these briefings, when we get information about behavior and avoidable behavior. It's not that someone's trying to get someone sick. We understand that. It's the acknowledgement that every decision we make in this process has consequences, and we know that in some cases the unintended consequences are one of your loved ones is going to get sick, and that's the last thing that we want for you or your loved ones. When we look at our total cases, 222 are female, 200 are male, 12 are under 19 years of age, 91 in their 20s, 61 in their 30s, 61 in their 40s, 80 in their 50s, 61 in their 60s, 35 in their 70s, 17 in their 80s, and 4 in their 90s. Breakdown of percentage, 24% are under 30, 39% are under 40, 53% under 50, 72% under 60, and 28% over 60 years of age. Breakdown by municipality, City of Syracuse 151, Town of Clay 47, Town of DeWitt 29, Town of Manlius 29, Town of Camillus 27, Town of Salina 26, Town of Cicero 23, Town of Onondaga 21, Town of Geddes 15, Town of Pompey 15, Town of Lysander 11, Town of Skaneateles 10, Town of Marcellus 4, Town of Van Buren 4, Town of Lafayette 3, Town of Atisco 3, Town of Tully 2, Town of Fabius 1, and Town of Spafford 1. The only town in Onondaga County that doesn't have a case yet is Elbridge, and the Onondaga Nation, who is working with our health department and coordinating with our health department if they believe someone is sick. We're helping our neighbors at the Onondaga Nation as well. What does that tell you? It's everywhere. It's in every county around us. It's in every end of our county. We're in a fight. We got to rally. Testing. So far, there have been 5,888 tests administered. 5,460 tests have been returned. We have 422 positives, 5,038 negatives. What's about these numbers real quick? I know this continues to be a topic in the media, and people get confused, and then I get phone calls. Think about this. 5,038 people were sick with something other than COVID-19. When it comes to testing, there has not been a shortfall of testing kits to do testing. If you go to a doctor or primary care provider, they have guidance on what they can do to have you get tested. If you go to the triage testing site, you call the Upstate triage line, there's guidance. If you don't meet that guidance, they may not deem you necessary to get testing. If that changes, that guidance changes, someone who might have been not with the specific symptoms, then maybe they can go get tested. But the reality is we aren't testing healthy people right now. We don't have enough tests for that. That has not changed throughout this process. Nobody's doing that. I would love to do that in Onondaga County. And to the critics out there saying you got to test everybody, go do a side business, manufacture 467,000 tests, and I'm going to buy them from you, and then you'll have a big business. But until we get to that point, our medical community is using the CDC guidance and the New York State Health Department guidance on who is sick with the symptoms that needs the test. And there's not been a day where we haven't had test kits in our county. We've worked very hard for that. So sometimes various reports get people confused on that. We received 238 tests back since yesterday. Right now, our percentage of those who are tested for COVID-19 that come back positive is 7.7%. So the other 92.3% of people tested right now are sick, just sick with something else. Process after the positive test, the health department's going to contact you, start their investigation about direct contacts, check on your health. You should also hear from your primary care doctor. At that time, we determine through our investigation potential direct exposures. Those are people that we then need in a quarantine. We then reach out to those individuals, put them in a 14-day quarantine. One of the things that we are asking people that we're starting to see a little bit is when you come down with symptoms, we ask you to contact your doctor right away and work with your doctor to get a test. Sometimes we've seen people got sick, they started to get better, and then they went in testing later and they got a positive. Even though they were getting better in their recovery, the challenge there is that who did you have contact with during that period of time? That's a greater span of time. Whereas when you get symptoms, we all know what they are. Call your doctor, call the Upstate triage line. Let's do it right away. They may say, look, we're not ready to recommend you get a test. That's your doctor's call. But we don't want you waiting for any reason. Call your provider right away. Looking at gaps in investigations, we talked about this. We've talked about when there's a gap in our investigation, we think there may be exposure to the public. We're going to share those gaps. I have a couple of them to go over with you right now, so let's get ready. If you were at Ollie's, O-L-L-I-E, Bargain Outlet on 3150 Erie Boulevard East in DeWitt, on Monday, March 30th, between 9 and 4 p.m., 9 a.m. to 4 p.m., or Wednesday, April 1st, between 9 and 5 p.m., we need you to watch your symptoms, and if you come with any symptoms, contact your doctor. Just because you went during these hours doesn't mean you had direct contact with anybody, but we had an employee test positive. If you were at the Colonial Laundromat, 408 Oswego Road in the Village of Liverpool, on Tuesday, March 31st, from 6:30 a.m. to 2:30 p.m., or Wednesday, April 1st, from 6:30 a.m. to 2:30 p.m., or Thursday, April 2nd, from 6:30 a.m. to 12:30 p.m., we need you to watch your symptoms. An employee there tested positive with COVID-19. So why are we saying this? There's gaps in our investigation. We haven't been able to figure out if you went, everybody who was there, and if they had direct contact. So just like we say every day, we're in a situation where there's a community spread of COVID-19. We need you to watch your symptoms every day. It doesn't hurt to take your temperature, even if you're not feeling sick. Just take your temperature every day. Be proactive here for your health. We need you to do that. Okay, positive cases released from isolation. We've set up an online portal system for there to have you, our positive case, our patient, go online and look at and update their information. This is going to help us expedite the review process to see if you meet the CDC guidelines to be let go out of isolation. Again, we want to ask you to continue to text message and communicate with our health department. We want to thank everybody. 22 in one day is it's a lot of work. We're glad that we have 22 people who've gotten better. That's important. A reminder on this, though, our health department has to release you. You don't get to release yourself. Social distancing, we've done a lot with this. I want to congratulate our counties around us that are coming on too. This is important. Where there's no walls between our imaginary borders between counties. People come into our county every day. We go into their counties every day to work. And so it's important that we all take this seriously. I'm going to go through some examples of times we didn't take it as seriously, kind of unforced errors. And certainly that's why we get frustrated. Everybody's working very hard. Our healthcare workers are working very hard treating sick people. They see every day what these people are going through, the struggle they're going through. So it doesn't just frustrate me when we make these mistakes. It frustrates them too, because they know how sick you are when you get to their care. And that's important to understand too. Let's put this not just the eyes of the county executive every day who's up here pounding the podium. Let's think about our first responders who are doing direct care every day and how hard they're working to keep everybody safe. Looking at this, we talked on Sunday about the social distancing. These grades on Unicast fluctuate. Our grade today, I know people are starting to really dive into the metrics that they use. That's good. But there are no better metrics yet for us to use. If someone has a better metric than this, please do share. We would love to look at all algorithms that are done in different ways to monitor social distancing. This wasn't a popular business, monitoring social distancing over the past few years. It's a business opportunity now, but the good news, we were C- the other day. We're at B today. That's good. We got to get to A. So thank you, everybody who's taking this seriously. I know most people that watch this are taking this seriously, but it's those who aren't watching this that we got to lead and communicate with so that they do take this seriously. What is important is that when we look at these examples, for us, it's not just the positive case, it's that gap between when they were sick and they got tested that they expose people to. It's the quarantines. It's the amount of work that goes into it that strains our infrastructure, and it doesn't help us flatten our curve. So that's why a couple things that we really need to focus in on are some of the preventable things about that. We have a new graph, though, over here to the left. I believe it is Upstate gave us some hospital numbers related to hospitalizations. That red is our curve. That yellow line that goes through, and then the green line represent 40% social distancing and 50% social distancing. I think we have all talked about we have to be on the yellow curve, but we need to make our own curve. Let's get to 60 and make our own curve so we can get our lives back. As we get more and more updated information from Upstate and other infectious disease experts that are working on these algorithms, we're going to share them. Our job is to make sure that everybody who produces these is wrong, that they're all wrong. We want them all to be wrong, and we want our curve to be its own story, and so that all the experts are wrong and we can get our lives back. How do we do that? We starve the virus and we stay away from each other. Let me go through a couple ideas, a couple examples of preventable scenarios that we continue to see. Sick people coming to work, okay? I wouldn't be talking about Ollie's and Colonial Laundromat if that didn't happen. If you're sick, you stay home. If you have an employer, for whatever reason, that is not being collaborative in this effort, you call my office and we'll talk to your employer make sure that they're reasonable. Having sick employees in your place of business is bad business. They're going to get your other employees sick, okay? Sometimes we have sick employees that go to work and they hang out with each other on breaks around the lunch table, okay? Then you get other sick employees, and so certainly these issues have happened. Proper social distancing outside of work. We were very frustrated yesterday. We are doing different mapping now, and when we're doing mapping via some of the municipalities, we look at the specific streets. There's various mapping spots on specific streets. What does that mean? I don't believe that means that everybody by chance went and got it somewhere else other than each other. So there's things that we have to recognize that as hard as this is, if we hunker down together now, we're going to be in a position to get our lives back in weeks, not months. So that's what we need to do. We need to flatten our curve and create our own curve. Certainly, we're going to probably talk about some more types of things we're seeing each day now. Why are we doing that? We're not trying to shame anybody. We're trying to show the public that this is real, that what is good intentioned normal behavior every day from 6 weeks ago, that same behavior, good intentioned normal behavior today, gets people sick. Our margin of error is zero with this virus. Okay, so we're not trying to shame anybody. We know nobody's trying to get each other sick, but we have to modify our behavior to starve this virus. Okay, our voluntary shelter in place we've put in. It looks like it's having some impacts. I think our amount of calls are down a little bit too. So we have a lot of unscientific things we look at as well within our own internal operation. But again, we put out some recommendations based off of the year you were born, what days to go shop. Some people call up and they say, I can't do it that day. Is it okay if I do it the other day? Another way to look at this is think about your behavior leaving your house a month ago and 2 weeks ago and last week. Cut it by 60%. Okay? That's our goal. Our goal can't be 50 anymore. It can't be the yellow curve. It's got to be 60. So cut it by 60%. So if you were going to the supermarket and the pharmacy and Lowe's or Home Depot last week by 3 times, you got to go once. Let's do that. That's the goal. This is voluntary, but I need your help. You can do it. So looking at our plasma project with Upstate and Red Cross, lots of people volunteering. Please volunteer if you're a positive case. This is something that a way that only you can give back at this point. That's something that we want to continue to see. Please consider registering for this project at Upstate's website. Access to assistance lines, our Upstate Triage Hotline number. Again, if you don't have health insurance, maybe if your primary care provider is inundated, they refer you to the line. You'll be screened with this line to see if you really meet the qualifications to go get tested. We aren't one of these communities that's been very rigid and conservative with testing. We've worked very hard to make sure we've had kits to meet the needs of everybody doing testing. It's not just it's not just the mobile testing site. The hospitals have been doing degrees of testing, and some of our primary care providers have as well. That number, 315-464-3979. Our seniors, healthcare workers, and adult nutrition hotline. This is a hotline that we put in very early in this process because we knew we had a lot of different folks, independent folks that were now asking not to leave the house. They're going to need help. Some of them are going to need meals. Some are going to need some groceries, some toiletries. Some of our healthcare workers are working odd hours. They don't have the ability to get to the grocery store. When they get there, they can't find the item they need. We have a team of volunteers helping to fill those gaps. That number, 315-218-1987. Child Care Solutions, some more heroes in this process. Our daycare providers, our child care providers, undervalued, underpaid, but have really stepped up in this process. I want to thank all of you. The phone number for Child Care Solutions is 315-446-1220. What is this? This is a daycare program for all of our essential business employees. If they have a gap in daycare, we don't want mom and dad or grandma and grandpa watching the kids. That's not healthy for mom and dad or grandma and grandpa. So if you get stuck, call this number. This is free daycare, okay, for the month of April. So please do that. We got this program. Vera House support and information line, 315-468-3260. There is absolutely zero excuse for abuse. We recognize that these are unique times. Mental health is an issue. People are in situations where they're together too long sometimes. Please contact Vera House if you need any assistance. That's very important. Donations of PPE, 315-435-2525. I want to thank a frequent person helping us with PPE, Benedict Dorn, getting us PPE, and others who continue to find small quantities of PPE for us. It all adds up. This goes to our first responders. This goes to our hospitals so that they have the equipment they need so they don't get sick. Okay, so I want to thank everybody for that. I believe the number 315-435-2525 again. Certainly, we've talked about mental health. Please contact 211 if you have some situations where you need to talk to somebody. Talk about strategies, ways to deal with what we're all going through right now. Certainly, 211 has professionals there as well. Questions? Yeah, I think we're seeing different ones, right? So I think under the category of unnecessary social gatherings, there's now, we're not going to pick on one municipality today, but because it's not the municipality's fault, it's the people who are just doing what was normal behavior 4 weeks ago, trying to do it today. We can't afford to do it, right? But certainly it looks like people are doing just natural things, and they're not cognizant of how serious this is and how vicious this virus looks for a new host. So we see streets, we see, when you look it out on a map, so that you see some different clusters that have happened. I think what's really tough and frustrating for me is when you have people who are sick that go to work. I've been saying this since we've been covering and talking about this. This is one of the things we were really scared about before we had positive cases. We said, we don't have positive cases yet. If you're sick, stay home. If your kid's sick, don't go to school, right? We took care of school, right? We shut down schools. But this is just something that is such a no-brainer that that frustrates me. And I know that the people who probably are in this boat feel, they understand that now. But let's learn from these examples moving forward. We're implementing these policies and trying to get the community to rally around something. Let's rally around a cause here, so to get our lives back. I mean, I don't know how much better it can get. We get people complaining about everything, about all these changes. The way that we can stop all these changes is to do this one thing: stay away from each other. Let's modify our behavior. Let's be unique. Let's chart our own path, our own curve. So Tim, you see it, and we're seeing that more. And every day there's kind of a new scenario that you're just like, geez, what were we thinking?
You mentioned transmission through play dates. Do the health investigators think they're seeing cases where kids, just playing in neighborhoods together are spreading it through the neighborhood?
Yeah, it's not the kids, it's the adults. So I think we had one case of a kid, but for the most part, under 19 numbers are closer to 19. All of those. There was when our timing on schools was very good, and that helped really contain what could have been a worse situation. So we didn't have any cases through really where we had impacts from schools. So we had there's teens that have been impacted by this, but when you look in those investigations, it wasn't from the schools.
Is there a way that the county is monitoring the participation of students that are doing programs throughout the county through their school district?
Yeah, Mary, we're not. That's really we've never had oversight really of school districts. Most of them are independent school districts with the exception of the city. My former life as a county councilor, we would have oversight of the city school districts, so that's a unique relationship. Where we've traditionally partnered with is our social workers and mental health workers being in those buildings. But this was unique. It's an emergency situation, state of emergency, we declare it. Then we have certain jurisdictional responsibility over districts and decisions. But related to the continuity of learning, they are responsible directly to state education. And look, at my wife is an educator, and it is a challenge. I mean, this is a challenge to get kids who are having a hard time. Think about how hard a time the adults are having with this. The kids are restless anyways. The kids can't see their friends. The kids don't get to go to work, some of them. The kids are at home, confined. So to have expectations that they're going to do well with continuity of learning outside of school, I don't think they're doing well. I think it's tough. So how do we fix that? Everything comes back to the same thing. We hunker down. We have a common purpose to starve this virus so we can get our kids to a better spot, get them learning again, get the economy going again, and that's our call. That's what we have to do.
And the governor did say today that there is evidence that the curve is starting to flatten because of the behaviors that we're all choosing. Most of us are choosing to social distance, but it's a really critical time to not get complacent when things are starting to go well.
Yeah,
so
I think the governor's right. I think the governor's looking at it through the prism of the state. When you have 90% or so of the cases in the state and the downstate region, he's really talking about downstate. So they hit where they went. We don't ever want to get close to that, right? We can't get close to that. So that's what our pressure is for what we're doing now. Is there's two theories. One, we're 2 weeks behind New York City because essentially that's when the cases came, and we're going to get hit hardest in 2 weeks from now. The other theory is because we were out in front of this, we were testing and identifying before, because we did what we did with our triage testing site, saving our emergency rooms, so that our medical infrastructure is not in jeopardy and they can focus in on these COVID-19 patients and get them better. That our curve might be this week or a little bit later. So I don't know. I would like our curve to be tomorrow to flatten out and get going the right way. But we know the only thing we can do is test, quarantine. We're doing that, and then starve. And so the starve is easy for me, for my workforce that I'm in charge with. Over 75% of the people are at home, right? It's easy for me in my own life. I got 3 kids. These kids are, losing their minds. They don't leave the house. They go in the front yard and play basketball or the backyard. But I need everybody else to take this as seriously so that we get our lives back.
You've mentioned people going to work sick today in some of your comments. But you've also mentioned the only people getting tested are people who are sick. Do we have any read on the number of asymptomatic people in Onondaga County?
No. I mean, and it's not going to, until I don't know if we ever will, Andrew, because at the point where they can give us extra tests, I think my hope would be they have enough where we can just go test everybody, right? And so then that maybe we'll hit that point at some point, but how do you figure out who to test who's asymptomatic, right? So our hope would be that you get rapid, fast testing in large quantities, so we can really move forward in a way that's nothing's ever 100% risk mitigation. But if you could test every person in the county, and you know everybody who's sick, and go get them help, and then you have quarantines for 14 days on everybody who had contact with them, you can let a lot of people go back to work. And then there's a lot of people in 2 weeks that are going to be better. You probably starved the virus pretty well in that scenario.
Are there any contact investigations where the source of the virus is such a mystery and the only last option is an asymptomatic person spreading the virus?
I think in these cases there's affiliations, so you can learn that. I'd be interesting to hear. That's a good question to ask 4 or 5 weeks after this is all done, as they can really dive into it. Look, I think back to our first 2 cases, right? Couple, they didn't travel anywhere. Who the heck did they come into contact with, right? I don't know if we ever figured that out, right? That was always an odd one. You always then our next few ones were travel related to hotspots. That made sense. So I think there's certainly probably some of those cases that exist, but there's certainly positives out there that would test positive that aren't symptomatic too, to your point, right? But that will be down the road. Right now, what we can control is our own behavior right now.
Hey, Ryan, just to follow up on the idea of flattening our curve and Cuomo's, sense that maybe downstate is flattening. If I'm reading this chart right, that green line is the same as the red line?
Yes.
Which is scary.
Yes.
Right? So we are not seeing a flattening. And in fact, we're headed in a direction we don't want to go.
Yeah, well, we would need for that to get better. Tomorrow I would need to come to you with information that said there's still 41 people in the hospital, or there's less people in the hospital, right? And then we would need to do that every day, right, for that number to get better. And that's why in the first week everybody's scared to death. Everybody's doing what we're asking. The second week, getting used to it. The third week, I think we're kind of comfortable. We can't be comfortable. So we ask to spread it out, change your behavior, wear masks. I see people wearing masks. When you go to the grocery store, you go to the Walmart or Lowe's or Home Depot, wherever you're going, wear one. Even if someone makes you one, wear one. Because these are all things other places have done and it's worked. But yeah, to your point, Tim, that's why saying when we talk about the apex, maybe the apex is right now. We'll know soon, but the reality is our hospitalizations, 15% is the highest number out of our active cases for hospitalizations. The ICU number is a little bit higher than where it's been. So that's a curve that has to get better because eventually that strains your infrastructure in your hospitals.
You've mentioned the financial crisis that will exist after the public health crisis is over. Has the county had to change any of its non-COVID related spending habits or been unable to pay some of its bills like some Americans, some residents aren't able to?
Yeah, we're paying our bills. The challenge is so our budget's already set. We can't go raise more revenue. So everything has to be done is changing our proposed spending. So we've put in, I believe, probably close to $12 million worth of austerity measures, essentially going through accounts and telling departments you are now taking an 8% cut in all these accounts. It was reported on our 103 line, our part-time line. We cut back the hours to 0 for 50% of those employees. we received some good news related to the FMAP funding from the state that the state got in the first stimulus package. That Medicaid might give us some Medicaid relief. You know, that could be worth $20 million, right? We have a hiring freeze, so that's worth money. So we are expecting a deficit of $50 to $100 million in county government. And $50 million is a lot of money to try to figure out that problem. $100 million is a real problem. So we're planning for all these things. And again, these are good conversations. I'm glad we're having these because we talk about a little shared sacrifice. What we're asking related to social distancing and in comparison to what other people are going through right now isn't a lot. It's not a lot. We just need people to get out of their own realms for a minute and look at the big picture here and look at the pain that a lot of people are going through and the pain people are going to go through and continue to go through.
But the county right now is able to spend any money that it's already committed to any other companies.
Yeah. Look, for us to be we're a big county. For us to run into cash flow issues, it would be in December, and we would a lot of bad things would have to happen. We'd have to be closer to a $100 million deficit. But look, at a part of this process, how do you keep yourself afloat? You blow through reserves, your fund balance, and all these things you don't ever want to do. It hurts you. You blow through your fund balance when you go to refinance your debt. It's like your credit score, your personal credit score. You have nothing in your checking account. You go to get a mortgage. You might get a higher interest rate, right? If you have the better credit scores get better rates. They're less risk. So these are things that same thing with government finances. So there are lots of victims in this process. This virus is a killer, and everybody needs to hunker down and really buy in for 2 weeks.
You gave us a racial breakdown of the people in hospitals, and Governor Cuomo talked today about the need to look at why there seems to be a heavier impact on African Americans. Does the health department have any insight into that?
Yeah, I think some of when you look at again, out of our 6 fatalities, all Caucasian. But we've had these discussions internally because we were seeing it in other parts of the country, and some of the things that we know are true related to public health and various demographics don't respond well to this. If you have heart disease or diabetes, this is not a flu you want to get, a virus you want to get. So some of these other ailments are more prevalent in different demographics. So that's an early assessment of why that may happen. We're very cognizant of that, and again, we don't see. We're trying to get more and more data. When you're looking at when people were tested, the testing process as this happened, there wasn't an ethnicity question. So you didn't have that data, but once they're in the hospital, it's a little bit easier to get the data. Other questions? I got an email yesterday, a great question from Tara related to asking if people are leaving ICUs and then going back home. The answer is yes. 34 people have been released from the hospital, and many of them did leave the ICUs. I think Andrew might have asked that question too. One of the things, folks, we got to do better with the masks and the gloves. People are just throwing them outside after you leave the grocery stores. Please don't. Think about why you're wearing them. You're wearing them because you're concerned about getting a virus. If somebody has to pick them up, they don't know who had that. That's not cleanly. That's not good. It's not good sanitary behavior. Please find a garbage can. Our grocery store partners asked me to say that. Also, I've had many concerns from some of our young people The Easter Bunny is going to be in Onondaga County, and the Easter Bunny is going to receive a pardon from me on social distancing. So don't be concerned about this. The Easter Bunny will be here this weekend to all of our young people. I know this is a big concern. So there's good news there that the Easter Bunny is coming this weekend. Thank you.
What's Andrew McMahon want from the Easter Bunny?
Police stuff. Yeah.